Good afternoon, and welcome to today's webinar, Supporting Us Sisters in Uncertain Times. I'm Jenny Sullivan, Vice President of Programs at Enroll America, and I'll be moderating today. Before we get started, just a couple of logistics items. First, this webinar is being recorded, and a recording and the slide deck will be shared in a few days. If you have questions during today's webinar, please submit them via the chat box. We will not be taking questions over the phone. Most of you are streaming your audio online, but for those of you who have called in, know that all phone lines have been muted. Finally, this webinar is not for press purposes. So let's get started. So less than 2 weeks ago, the ACA as we know it was under imminent threat. Fortunately, we can begin today's webinar by breathing at least a temporary sigh of relief, knowing that nothing has changed for consumers who rely on the ACA for affordable health coverage. And the story of the past 4 years has definitely been one of progress by any measure. Whether you're the analytical type who sees proof in the statistics or someone who measures progress by personal stories and faces, the landscape has been forever changed because of the work that went into setting up the marketplaces and the new Medicaid infrastructure, conducting outreach and education, providing ongoing in-person help with applications, resolving data matching issues, helping consumers choose the right plan, or reminding them to renew. Even before the fourth open enrollment period, Enroll America's uninsured model showed that the uninsured rate for non-elderly adults declined nationally by nearly half between 2013 and 2016. Uninsured rates in all 50 states and D.C. have declined since 2013, and about 90% of counties saw their rate drop by a quarter or more. Finally, the uninsured rate declined across every demographic group accounted for in our model, including all racial and ethnic groups, all ages and age groups, men and women, and for residents of metro as well as non-metro areas. Plus, 12.2 million consumers chose a marketplace plan for 2017, and as of December 2016, an additional 16.2 million individuals have enrolled in Medicaid or CHIP since the start of the first open enrollment period. And yet, of course, this is undoubtedly a time of uncertainty and transition. All of the organizations that will present today have been hearing similar questions from assisters. Like, what will federal navigator allotments look like for next year? Will my state expand Medicaid now or attempt to make changes to its current program? What will a shorter open enrollment period mean for my work? There's a lot swirling and things change, sometimes by the hour. We're going to do our best today to get everybody on the right page and on the same page about what we do know, what we don't know, and what sense we can make of it as we go forward. The goal of today's webinar is really to provide a status update of efforts to repeal and change the law, including what they mean for navigators and other assisters, ideas for messaging to consumers during this challenging time, and a roadmap of assister resources available from national organizations. As many of you may already be aware, Enroll America will be closing our doors later this year. More on that later, but today marks our final webinar for a national audience. So, I am happy to say we've pulled out all the stops to really bring you an all-star panel of leaders in health policy and enrollment to present today. First, to help us understand the most recent legislative threats to the ACA and where things may go from here, what we're calling what might happen, we'll hear from Mara Udelman, Managing Attorney at the National Health Law Program. Then we'll move into more concrete matters like recent proposed federal regulations, what we're calling what is very likely to happen, with Rochelle Brill, Policy Analyst at Community Catalyst. We also knew it would be critical to put all this information into the consumer context today, so after Rochelle, we'll hear from a trio of presenters to help put things in that context. Hallie Cloud, Health Outreach Manager, and Shelby Gonzalez, Senior Policy Analyst, both from the Center on Budget and Policy Priorities, and Liz Hagan, Associate Director of Coverage Initiatives at Families USA. Finally, I'll share a bit more about what Enroll America's Sunset means for our tools and resources, and we'll hear more about the resources assisters can rely on each of our panelists' organizations to provide going forward. With that, I am happy to transition now to Mara Udelman to get us started. Mara?
Great. Thank you so much, Jenny, and thanks to you and everyone at Enroll America for all the work you've done over the last number of years and all the work that you're doing with us as we've been able to move this webinar forward. We're really thrilled to be able to partner with you today as we have over the years. Next slide. Many of us learned about how a bill becomes a law originally from Schoolhouse Rock. Next slide. I think what we've seen over the last couple weeks is it's a little bit more complicated, and many of us would not like to have seen what has been going on. But what I want to try to do is get you up to speed with what has happened, what actually is happening and has happened in the last couple of days, even before after we finalize these slides, and what might be coming attractions. So next slide. The American Health Care Act is what the House Republicans called their legislative language, or their bill, to repeal the Affordable Care Act. They were going through a budget process, and so unlike creating regular legislation, the goal of this legislation was to cut funds and to meet target numbers in the budget. So originally and initially it started out as a bit of an artificial process. It's not what's the best policy or law that we can make, but how do we cut certain amounts of money from the federal budget. The bill was originally introduced on March 6th. There were what are called markups in the House Energy and Commerce and the House Ways and Means Committee, which means the committees look at the legislative language and decide literally if they want to mark it up or make any changes, take things out, add things in. The legislation was voted favorably out of both committees, so they both passed the legislation. It then went to the Budget Committee, which, because this is a budget bill, has a role in this process. And then it went to the Rules Committee. The Rules Committee in the House actually sets the rules for how a bill will be considered when it comes to the House floor for debate. As you probably saw covered in the news quite a lot a couple of weeks ago, on Friday, March 24th, the House leadership and POTUS, the President of the United States, actually pulled the bill before it could be voted on, because at that point it was pretty clear that the bill would not pass the House, that they did not have enough votes to pass the bill. Next slide. I want to go through briefly what that bill would have done and also what it would not have done, and then we'll talk about what the next steps are. So overall, the American Health Care Act, or ACA as we've been calling it, would have had a dramatic impact on marketplace enrollees and the consumers that you've been working with. Again, this has not passed yet, but this is what the bill would have done if it was passed, or it may pass in the coming weeks and months. So first, there would be less money for advanced premium tax credits or premium tax credits. It would be a maximum of $4,000. The tax credits would be based on age rather than income. So individuals who are lower income would not get a higher tax credit. There also would not be any geographic variation. So you may have seen in the news that health care can cost an awful lot more in Alaska than it may cost in other parts of the country, and yet the tax credits under this bill would not have had a geographic variation. So whether you lived in a high-cost health area or a low-cost health area, you would get the same tax credits. The Affordable Care Act, or Obamacare as many people call it, limited the amount of the difference in the premiums that an individual would pay based on their age. So it included a spread of only 3 to 1, which meant that older people would only be paying 3 times as much as younger people. In ACA here, it would allow at least 5 to 1. And what this meant also is that while the tax credits were lower, that older individuals would also be paying significantly more, sometimes $10,000 or more to get a comparable plan. ACA would also let people use tax credits outside the marketplace. It would repeal the cost-sharing reductions, or CSRs, in 2020. One thing I do want to emphasize is this legislation did not have any legislative changes to assister programs. So there's nothing that's expected right now, but it is something that we are going to continue to monitor. Next slide, please. A couple more features of what ACA would have done is, instead of having the individual mandate where everyone has to buy insurance or pay a penalty when they file their income taxes, ACA would have gotten rid of that individual mandate and instead let health insurers and health plans charge individuals 30% more for an entire year if an individual had a gap of more than 63 days in coverage. The bill also would have removed the actuarial value requirements so that you would have seen likely greater cost sharing and deductibles, although there would have still been the limits on out-of-pocket costs and also essential health benefits. It repealed virtually all the taxes that funded the ACA, and it repeals the individual and employer mandates. A late discussion was that ACA would actually repeal essential health benefits. The way it was originally put into the bill that was considered a couple weeks ago, it was a little bit unclear, but we know that that is one of the intents that Congress and the House Republicans would like to see. Next slide, please. ACA also would have dramatically restructured the financing for the Medicaid program. And we know many of you have helped lots of people enroll in Medicaid as well as the Children's Health Insurance Program, since there is a unified enrollment at this point. So ACA would have paid for a lot of these changes and the repeal of all of the Obamacare tax cuts by slashing the funding to Medicaid very dramatically. And this is sort of the potential impact. It's hard to actually say a direct impact like the last couple slides did, because a lot of this is how things play out in the states. But it would be very likely that if ACA was enacted, that states would stop their Medicaid expansion program because they would have to pay more of the costs. States also would likely cut optional benefits or cut provider rates, because their funding from the federal government to help pay for Medicaid would be dramatically cut. So all of this would make it much harder for individuals to enroll in Medicaid, and even if they get into Medicaid, it would make it much harder for them to actually find health care providers who are participating. Next slide. There also was a lot of talk in ACA about new proposals to impose either a block grant or a per capita cap on the Medicaid program. Again, if you'd like some background information on this, excuse me, you can go to NHELP's website, as well as the websites of all the other folks on this call who are presenting. We've all done a lot of work on this. But just to summarize really quickly, right now the way Medicaid works is if a state enrolls more individuals, it can still get more federal funding. And if it adds more services or new prescription drugs, or it wants to pay providers more, it can still pull down more federal funding. There's no limit on the federal funding in Medicaid under current Medicaid law. Under ACA, or a per capita cap or block grant proposal, the risks would be transferred directly to the states. And if a state wanted to add more services or cover more prescription drugs or cover a new high-cost prescription drug or a new high-cost screening test, the state would bear the brunt of paying for almost all of that new cost. Medicaid wouldn't ebb and flow as it has done over its last 50-plus years of history. So this is also a dramatic restructuring of Medicaid in an attempt to pay for the repeals of the Affordable Care Act. So this really is a double whammy that we're seeing with the American Health Care Act, and another really important reason to know what's going on and to look and get involved. Next slide. So one of the things that came out is the Congressional Budget Office, or CBO, and the Joint Committee on Taxation have to come up with a score for legislation that's being considered by Congress. The estimate on ACA said that 24 million people would lose coverage overall. So this includes both Marketplace as well as Medicaid enrollees. It would cut $880 billion from Medicaid, and at least initially the average premiums would go up because without the individual mandate, healthy people wouldn't sign up. If you want to take a look at this report, it's available online at the Congressional Budget Office website, and we've included the link here. Next slide. So the crystal ball is what's next, and we really don't know. Actually, just this morning, we started to hear that there are further discussions going on between the President and the House Freedom Caucus, and they're trying to come up with a compromise that can be supported by the Freedom Caucus, which is on the more conservative end of the spectrum and would like to repeal all of Obamacare. Some of the pieces that we've heard are being considered this morning include a full repeal of, an allowance for the states to get rid of essential health benefits, and an option for the states also to get rid of community rating. Community rating is the piece of the bill that prohibits insurers from charging individuals more based on their health history or pre-existing conditions. So while the bill wouldn't explicitly repeal the prohibition on pre-existing conditions, it would indirectly do this by allowing an insurer to either charge more for a cancer patient or someone who needs prenatal coverage and maternity care, or it could exclude chemotherapy drugs from a plan so that no cancer patient is actually going to participate. These are very significant changes to ACA and just continues to make this bill even worse than it was a couple of weeks ago. Next slide. So in terms of what could happen legislatively, the House could bring the same bill back, but we think that's unlikely. But as of this morning, it does look like they're making changes to that bill. And this is what changed from when I finalized these slides last week. They might try to have a vote on this by Friday, this Friday, before Congress leaves for its 2-week recess in April. So it is really important to get the word out right now. and to follow what's going on and to see if there are ways that you might want to help educate consumers and also your elected representatives to the extent that you have that ability. There also are other possibilities that could happen. Again, we don't know. It really does change literally sometimes hour by hour. So the House could decide to let the Senate start the process, or the House could restart a bill later this year. But as of now, we really do think there's a good chance that they're going to try to actually push this ACA bill forward and try to get a vote as quickly as in the next couple of days. Next slide. So there's a lot of activity that also can happen administratively within the federal agencies themselves. So HHS and the Centers for Medicare and Medicaid Services and then CSIO actually have a lot of authority for implementing the Affordable Care Act. There's actually still a lot of positions that haven't yet been filled at HHS and CSIO. With the change in administration, many of the top political appointees have left. So for example, there is not yet a new administrator for CSIO. Kevin Cunahan left when there was a transition after President Obama left office and President Trump took over. And a number of other positions in HHS and CSIO have also remained unfilled at this point. But there still are opportunities to act administratively. There's issues that can be done with cost-sharing reductions, with regulations, with QHP accreditation. So we're waiting to see how this is going to happen. With my last little bit, next slide, what's next for assistor funding? We have to assume at this point that there are no changes. We haven't heard anything yet, so we're just going to go with the status quo. Rochelle is going to talk about some proposed regulations which we expect to be finalized soon and what that might mean. But as of now, we're just assuming that things are going to continue apace until we hear otherwise. And so on my last slide, just to sum up, it's really important that these attacks are going to continue. We thought that they were gone on the 24th. They're back again now. They're just going to keep coming. So we need to monitor, be vigilant, and keep up to speed on changing developments. And with that, I will turn it over to Rochelle.
Thanks, Mara. Thanks so much for that summary. Hi, everyone. My name is Rochelle Brill, and I'm a Senior Policy Analyst for Community Catalyst, a national healthcare advocacy organization based in Boston, Massachusetts. And I'm also a member of the In the Loop project, along with Mara Udelman, who just spoke, but which we'll get into a little later in the presentation. I'm going to be speaking with you today about some of the upcoming enrollment policy changes that are very likely to happen at the federal level, which are the regulatory changes that the Trump administration and Secretary Price of the Department of Health and Human Services have proposed with respect to the marketplaces. I'll be speaking about some of the proposed changes to the annual open enrollment period and the guaranteed availability requirement, while my colleagues at the Center on Budget and Policy Priorities will be speaking about the proposed changes to special enrollment periods. Next slide. So first, I just wanted to start off with some background on the proposed rule. The rule was announced as the Market Stabilization Rule. It came out on February 15th of this year, 5 days after Tom Price was confirmed as Secretary for HHS. And the proposed regulations had a comment period of about 20 days, with comments due March 7th. The press statement regarding the regulations stated that in addition to attempting to improve the stability of the marketplaces, the proposed rules were also intended to, quote, provide more flexibility to states and insurers and give patients access to more coverage options. While we don't know the exact date of when the regulations will be finalized, we think they'll likely be published soon, within the next month or so, because HHS intends to implement some of the proposed changes starting in June of this year, as my colleagues will discuss a little later on. Next slide. So getting into the rule, one significant change affecting enrollment work towards the end of this year is the proposed change to the 2018 open enrollment period. As some of you know, the Affordable Care Act intended for this upcoming open enrollment period to run from November 1st, 2017 through January 31st of 2018, similar to this past open enrollment period. But the Trump administration has proposed to change the dates from November 1st to December 15th of this year, shrinking the open enrollment period from 12 weeks to 6. These are actually the dates the Obama administration had been planning for the 2019 open enrollment period, and so the Trump administration is seeking to implement these changes 1 year earlier. Some of the potential benefits that they note in the regulations are that having an open enrollment period that begins and ends in the same calendar year allows everyone enrolling to receive full year coverage because everyone's coverage effective date would be January 1, 2018. Additionally, this window better aligns with the traditional open enrollment periods for Medicare and employer-sponsored insurance plans, and therefore would allow for easy opportunities for plan comparison for individuals who are eligible for more than one of these programs. However, some of the concerns with this change to the open enrollment period is that obviously a shorter time frame will automatically lead to consumers having less time to enroll. And the drastic change in the dates from last year to this year will mean that there's just going to be a strong need for outreach and messaging so that consumers are aware of this shorter window. Next slide. Another aspect of the proposed rule affecting enrollment is a change to the interpretation of the guaranteed availability requirement, which is the Affordable Care Act's requirement that insurers continue to offer coverage to any eligible individual. This had been interpreted to mean that if an enrollee was terminated due to not paying their premiums one year, but then wanted to enroll in a plan with the same insurer the following year, the insurer would have to offer him or her coverage regardless of the history of non-payment. Under the proposed rule, however, insurers would not be found to violate the guaranteed availability requirement if they decide to attribute payments for a new enrollment to any outstanding debt from a previous year, from a prior enrollment. Additionally, insurers can refuse to effectuate coverage under this new interpretation for any new enrollment until all past premiums from a prior enrollment are paid. And so this rule, if it is finalized as proposed, could lead to issues for consumers being able to re-access coverage if they were terminated due to non-payment. Next slide. So that concludes the proposed changes within the regulations that I'm going to cover for today. And so the last thing I wanted to mention just regards the roles that assisters can play in educating consumers about these changes. As many of you know or I'm sure have experienced, assisters have really been the eyes and ears of Affordable Care Act implementation for the past few years. And so consumers may come to you with questions regarding these regulations once they're finalized. And as Mara mentioned, because the Department of Health and Human Services is still within a transition period in terms of staffing levels, their resources and responsibilities, the transition period might also lead to consumers coming to you with more questions because maybe they won't be getting the same type or amount of information they'd been getting before. And of course, while you're not expected to be a healthcare policy analyst who knows the ins and outs of these regulations, one of the important roles you can play is to continue to educate consumers about what the current law is now, before the proposed rules take effect, as well as once they're finalized and begin to be implemented, such as the new dates for the upcoming open enrollment period, being able to communicate that the changes have occurred and how they'll affect consumers. And of course, please feel free to come to any of us on this webinar or our organizations with questions that you're struggling with or would like more clarity or information on. I'll now turn it over to my other colleagues joining me on this webinar who will continue to discuss ways that assisters can help consumers at this time, as well as resources to help you do so.
Thank you, Rachel, and hello, everyone. Hallie and I are going to quickly review a few areas of work that assisters can do right now and to give a quick preview of some changes that are coming to special enrollment periods. So my next slide. So I know most of you are really familiar with these steps that people must take to keep coverage, but I wanted to point out that it really has been an unusual time given so much media about the uncertain future of the Affordable Care Act. And quite frankly, it's really difficult to know if this uncertainty would make it more or less likely that people will take all the necessary steps to maintain their coverage. So with that in mind, it may be good to reach out and remind people that you help to enroll to pay their premiums and why health coverage really matters. It's also helpful to remind people about the importance of resolving any data matching issues and help them resolve those issues if needed. Just a review, data matching issues occur when the Marketplace application can't use electronic data matches to verify certain eligibility factors like income or citizenship status. The good news is that things are getting better. Less people are experiencing data matching issues, and among those who do experience these issues, more people are successfully resolving them than what we've seen in past years. So that's really great news. A couple of reminders about sending in proof of income, and I share these because I think this has been the area that's been the most difficult. So when people have income data matching issues, they must send in documents that prove income that was projected in the application. So that means if a person said her income was going to be $24,000 a year for 2017, if she sends in a pay stub that shows her income for January was $100, that's not going to work. At a minimum, in a case like this, a person would also have to send in some type of explanation about the difference. Why is it only $100 when my income projection for the remainder of the year is going to be so much more? But always better, if possible, to provide more proof if proof is available of the situation. Also, if income has changed, then the person should go back into the application and make that change. And sometimes that action in and of itself will go ahead and clear up a data matching issue. May also create a new data matching issue, but that's a risk that you'll have to take. Next slide, please. Next slide, please. So most of you have probably seen lots of media coverage about the new administration's activities related to immigrants. In particular, the administration has been ramping up immigration enforcement efforts, and there was a leaked executive order that has not been released, but if it were to be released, would make it so that some immigrants who are lawfully in the U.S. would become fearful of accessing any public benefit programs. Because of these and other actions, there's an environment of fear, and many immigrant families have begun to ask to be disenrolled in a variety of different benefit programs, including marketplace coverage. We're really concerned about this, as you can imagine, and we're suggesting to let consumers know that nothing has changed related to immigrants and public benefit access, and we don't have any reason to believe that disenrolling from benefits would be helpful at this time. Many groups are monitoring this situation closely, including those of us on the phone today, in particular NHELP and National Immigration Law Center and CBPP and others. So I've included some links to different resources that are helpful on this topic and contact information. And we really encourage any of you who want to share your concerns or stories that you've been hearing about from the field, or if you want to learn more about this issue, that you should contact us. With that, I'm going to turn it to Hallie.
Thank you, Shelby. So I'm going to talk about primarily about special enrollment periods, and I know that most of you are pretty familiar with special enrollment periods at this point, but just as kind of a really quick refresher, people can enroll in a marketplace plan during open enrollment or during a special enrollment period, which is triggered by certain qualifying events. There are 6 basic categories of SEPs that are laid out by the marketplace that are listed here. And over at our Health Reform Beyond the Basics website, we have an in-depth webinar and SEP reference chart. That link is at the bottom of the slide, and that lays out all of the different triggering events and has a ton of detail on all of these different qualifying events that will get you an SEP. The proposed market stabilization rule that Rochelle talked about earlier included a lot of changes to SEPs, which we'll talk about in a minute. So please note that our current resources lay out the SEP rules as they stand now in regulation, but we'll update everything as soon as that rule is finalized. So for now, let's talk through the process of accessing an SEP as it stands now. In states using healthcare.gov, people who trigger an SEP based on the most common types of SEPs, like losing other coverage or marriage or birth, are asked to provide documentation of that triggering event. Really importantly, they can still enroll in coverage, but will be asked to submit documents that prove the triggering event actually happened. Most people will submit documents and never hear anything else about it. Some applicants will be asked for follow-up documents and will need to provide more information to prove their eligibility for an SEP. And in some cases, if that group of people does not provide additional documents, they could end up losing their coverage. But again, most people aren't asked for follow-up documents and never have a disruption in coverage. As a side note, it's really important to distinguish this SEP confirmation process from the data matching process that Shelby talked about. Sometimes the notices can be really confusing and you're asked for a lot of documents. So there are different processes. This confirmation process is not an eligibility requirement. It's just trying to confirm that people are eligible to enroll in coverage outside of open enrollment. And documentation is asked of everyone who sort of triggers these certain SEPs. Next slide, please. So now let's go into some of the changes we expect to happen later this year. As Rochelle mentioned, there's a proposed market stabilization rule that we expect to be finalized in the coming months. We expect the rule to be finalized as proposed, but once it's officially out, we'll do a webinar that has all the details on the changes to these SEPs, but here's sort of an overview. I'm going to focus on the last bullet on this slide first because it's really important to understand how this new pre-enrollment verification is going to be really different from the current confirmation process. So a pre-enrollment verification pilot was announced last summer. That was scheduled to begin later this year, but this new proposed rule makes the verification much more expansive and phases it in much more quickly. So starting in June, people experiencing an SEP will be required to send in documentation of that qualifying event before they can enroll in coverage. People who lose other coverage and possibly those experiencing a permanent move will be the first bucket of SEPs that will require verification. And since the vast majority of people who get SEPs are losing other coverage, that's going to be a lot of people that you see. So over the course of the summer, new categories of SEPs will be added to this process until most qualifying events will need proof before a person can enroll. There will be some efforts to automate some of the verification process, but that's going to take a lot of time. So as far as we know for now, as the pilot rolls out, anyone experiencing one of the SEPs that require verification who is newly enrolling in coverage is going to be asked for documents to prove eligibility. It's important to note that those who are already enrolled in marketplace coverage will not be required to verify SEP eligibility, but their ability to change plans is going to be really limited, which leads us to some of the other changes we're expecting to see in this rule. People already enrolled in a marketplace plan will only be allowed to change to another plan that is within the same meta level as their current plan if they are eligible for an SEP. In addition, enrollees who are adding a dependent, so if they get married or have a baby, something like that, they'll only be allowed to add that dependent to their current plan. And making SEPs even more restrictive, nearly all SEPs will require that a person had prior coverage at some point within the last 60 days in order to qualify for that SEP. So for example, if someone gets married, at least one spouse will need to have had 1 day of minimum essential coverage in the last 60 days in order for the couple to qualify for an SEP. So that's a big change. And if you're wondering how this interacts with the pre-enrollment verification, any SEPs that have this requirement of prior coverage will need to both prove that they are eligible for an SEP and that they had some sort of coverage in the last 60 days. So it's going to be a lot of documentation before someone can even begin their coverage. So needless to say, you are all going to have a huge important role to play in actually getting people through this process. People will need help understanding what documents they need and how to get them if they're not readily available. And as Rochelle mentioned, we're also expecting a shorter open enrollment period this fall. This shorter enrollment period combined with the fact that SEPs will be much harder to get means that getting people enrolled during open enrollment will be really so much more important. And as I said before, we're going to have a Beyond the Basics webinar that will lay out these changes in much more detail once we have more information and once this proposed rule is finalized. So definitely check healthreformbeyondthebasics.org for updates. Next slide, please. And now to end on a little bit more of a high note, people can enroll in Medicaid or CHIP at any time during the year. There are no enrollment periods, so if a person meets the eligibility requirements for Medicaid or CHIP, they can enroll. Some people, like kids or an elderly person, can have different eligibility rules. Kids can have coverage at higher income levels, so it's always a good idea to see if a family you're assisting could be eligible for Medicaid or the Children's Health Insurance Program. Even if you're not sure if someone is eligible, it never hurts to apply. So with that, I'm going to turn it over to Liz Hagan at Families.
Thank you so much. And I'm really excited to join this webinar to talk a little bit about the perspective that you all bring as assisters. Knowing since the election, many of you have questions about what this work means for the consumers you're working with, and just looking at some of the questions that are coming in, really what this work means for you. And I wanted to just mention a couple things, or talk a little bit about some of the work you can do both in public education and advocacy. And the real focus, I think, of your work, knowing that you're really helping consumers with the direct assistance, can really help shape public policy and the work that's going on both at, here in Washington, but then also across the country at the state level. And because of your roles working with consumers, you really have that unique perspective of not just one consumer who's sharing their story, but the hundreds of people that you've helped or, throughout the last few open enrollment periods. Whether someone is having a deductible that's too high, whether they're in the coverage gap and they want their state to expand Medicaid, whether there's not enough plan choices or too many plan choices in their area, you're really able to talk about the experiences that consumers have on the ground. And we know that you wear many different hats. Talking with the sisters, I know that you're focused on the eligibility and enrollment process. You do outreach. You oftentimes feel probably like a little bit of a therapist. And you also have the role of health educator, financial advisor. So I don't at all want to say that you should add more things to your plate and that doing advocacy is one more of many things that you can be doing. But I know that just in the work that you're doing and the interest that you have in this work, that many of you are actually interested in doing some degree of advocacy. Of course, the sort of elephant in the room is, can you do advocacy, and what does that look like? And I'll talk a little bit about what that means, but I think one thing that I always remember is that enrollment to some degree is advocacy, just because of the fact that you're helping to implement part of the Affordable Care Act, and you're helping to make sure people get enrolled in coverage. And over this last open enrollment period, with so much uncertainty that was going on, it was really critical that people got enrolled in coverage and sent a signal that people still wanted coverage and that there was still demand. So a couple of the real key considerations to keep in mind before getting involved in advocacy or public education is, first and foremost, and I think these are the big things to take away from my part of the webinar, is that consider what funding sources you get, whether you're getting funding from the federal government or grant funding that prohibits certain levels of advocacy or public education. The second big one is, of course, organizational considerations that you might have, whether you're housed within an organization that does many different things and prohibits what you're allowed to do on the advocacy side of things, whether your supervisor has a specific role for you, whether your board has specific things that you are and are not allowed to do. Those are important to keep in mind as well. And then lastly, I think with any of the work that you do, of course you want to think about what you're comfortable with in your own role, and whether you're able to do something as an assister or whether you're able to do something on your time as a private citizen. Those are all important considerations to keep in mind. So what is permitted, and some of the different things that I just mentioned. Of course, many of you are coming from nonprofit organizations, 501c3s that prohibit certain degrees of lobbying, the ability to promote specific legislation, whether you can endorse a specific candidate. And the real important piece there is, of course, to focus on the issue and not specifically on legislation or candidates, and there's some limitations on what you're able to do as a nonprofit. And then, as I mentioned, grant rules, whether you're getting federal funding for the Navigator program or as a community health center through HRSA. Some public education activities might fall within grant duties that you have from private funding, and some may not, so it's important to keep those in mind as well. And then lastly is state rules, whether there's restrictions on the activities that you're allowed to do that your state imposes. So really important to think about what balance makes sense for you, from public education to direct assistance, and a whole range of activities that you can do that fit within the scope of the work that you're doing. And you can think about some of the work that you can do at the local level, the state level, or the federal level. So some of the things you might consider doing at the local level are working on specific coverage options that exist within your city, working with sheriffs, judges, or mayors on activities that they might be doing on outreach or defense work. State-level advocacy, you can work with Medicaid agencies, CHIP agencies, the state-based marketplace if you're in a state that runs its own marketplace, or working with the Department of Insurance in your state. On the federal side of things, and I think this is one thing that people think of traditionally when they think of advocacy, that it's this, that, you know, it always has to be done with Congress, and there's a lot of different iterations of what you all can do. There's the legislative branch, of course, and that's meeting with members of Congress, whether it's your senator or your congressperson, doing work on advocacy with the administration, the Trump administration, through the Department of Health and Human Services, which I'll talk about in a moment. And then to some degree, whether you might be able to influence the dialogue and conversations that are happening with some of the litigation and judicial side of things. So what can you do? I think one of the big things that we've seen both on the advocacy side of things but then also on outreach and education is story banking and making sure that people's stories are elevated and people understand what coverage options are available to them, especially as the other speakers mentioned. There's a lot of confusion going on right now to make sure that people know people can get coverage and showing what the real impact is on the community. Working with the media can be very similar, writing op-eds, doing press interviews, and talking about enrollment in a way that lets people know what's still available, special enrollment periods, Medicaid, marketplace coverage. Working with advocacy partners is always important. There's a lot of advocacy organizations across the country and states and national that aren't direct service organizations and would love to hear from you about what your experiences are with consumers that are actually seeing what this looks like on the ground. As I mentioned, meeting with meeting with elected officials, whether it's a mayor, a governor, their offices, or working more with elected officials at the federal level. And then I think one of the big things would be tracking consumer experiences in a way that you're able to see what's happening. You can track whether there's problems that are happening on the enrollment side of things, whether there's issues with people being able to pay their premiums, or more general issues like affordability and plans offered in their area. Social media is a big one, of course. Twitter, Facebook, we've seen a lot of activities going on Facebook Live, for example, and those are good ways to get the word out and spread some of the information that's going on. Writing comments. We heard from a couple of the different speakers talking about what's going on at the federal level with changes to the special enrollment periods, the shortening of the open enrollment period moving forward. And we have seen a lot of advocates and assisters actually that wrote comments about what that would mean for their work. And there's a lot of other opportunities as well moving forward with waivers to the Medicaid program, for example, things that might require work requirements for Medicaid. And then there's also at the state level things that you might be able to impact on the Medicaid side of things, or Department of Insurance as well. As was referenced, the leadership, of course, at HHS and CMS is different than it was under the Obama administration, but there are a lot of people that work there that have worked there and continue to work there and are career officials, and it's important to raise issues with them, whether it's in your grant reporting or just talking with people at the different agencies that are doing this work. And the last, and we have a webinar that I can share a link to later, is getting involved in voter registration and helping people with the referring to being able to register to vote, or actually helping with them if you're able to do that within your role as an assister. So just to emphasize here, the story banking side of things I think is a really important piece. We hear time and time again, as you saw, the passage of the American Health Care Act did not move forward, and part of that I think is because people really stood up and shared their stories, shared what it meant for them. We saw really unprecedented levels of advocacy going on around the country, and it was really important to raise people's voices up and let policymakers know what it really meant and what this work means moving forward. So I'll turn it back over to Jenny to talk a little bit about some of the resources that the different organizations on the webinar have to share. Great. Thanks so much, Liz. And I'm actually going to talk a little bit about what's going on with Enroll America specifically because obviously we are getting ready to wind down our operations. But I'm going to, after that, move to questions because we've been getting quite a few from our quite large audience this afternoon. But while we answer those questions, I will slowly in the background flip through some slides that have the contact information and reminders of all the different organizations that have presented today, so that you can subscribe to their list if you haven't already, or reach out to the individuals that work with those organizations and operations so that you can be on as many lists as possible so that you can continue to hear from these folks. So Enroll America is, as we announced a few weeks ago, winding down our operations this year after almost 6 very successful years. Our policy support will be phasing out in a few weeks. Our state-specific programs are winding down on their own timelines, but all of them will wrap up by August. If you're an assister, you may be most familiar with us in addition to sort of some faces and names in your coalition work in your state. You may be most familiar with our digital tools. Our Get Covered Connector is going to continue on in the excellent leadership of the organization Young Invincibles, who I think many of you may be well familiar with at this point. They are going to take on that tool and continue to make it available to assisters around the country, so more to come on the details of that transition soon. 2 of our other digital tools, our Calculator and our Plan Explorer, Plan Comparison and Out-of-Pocket Cost Comparison tool, have been discontinued. You will no longer find them online. They have been taken down, but we've provided a couple alternatives here if you are interested in using other tools that would perform similar functions. And you'll also notice, if you happen to be online, that our Get Covered America website has been taken down. That has been pulled down because that was our consumer-facing effort, which really is coming to a close at this point. But many of our publications, our maps, our data are going to live on in the excellent care of Families USA. And there's a URL on this slide that shows you where those will live. They're not there just yet, but they will be housed there, and a lot of information that you've come to rely on Enroll America for over the years will be archived with families. So I'm happy that partnership is moving forward. I'm really happy to see that happening. At this point, we have about 10 minutes left, and like I said, I'm going to flick through the slides in the background while we answer some questions from our audience because we have been getting lots. And I want to start with one that I think is probably of great interest to most folks on the call, which is, and I'm going to start with Mara here, if you can comment a little bit more on funding for FFM navigators. Will that funding need to be appropriated for this coming year? We are nearing the end of the second year of a 3-year funding cycle, so is that funding guaranteed or not? What more can you tell us about what we do and don't know about funding, the future of federal navigator programs, Mara?
Sure. So originally the latest round of funding was for a 3-month award cycle. It was for the 2016, 2017, and 2018 plan years. Last year, those of you who received first-year awards do remember that there was a second round where you had to provide some additional information, and the funding shifted a little bit. And so, as I said earlier, we expect a similar process this year, that there will have to be sort of, the process going through of providing updated information and then determining the funding levels for everyone. As I said, we don't know if the funding level will change. It has been sort of coming out of the budget that HHS set aside to run the FFM marketplace. If you're in a state-based marketplace, obviously the funding comes from your state-based marketplace, so this doesn't affect you as directly, but we've seen funding change there as well. So overall, this is one where we're going to have to monitor the process and see what the new administration decides to do. And there are a lot of open questions, but until we hear otherwise, we're going to assume the status quo and assume that the funding will continue for the 3rd year. But again, we're just going to have to wait and see as this plays out over the next sort of weeks and months before the funding is finalized.
Great. Thanks, Mara. The next topic that I think could benefit from a little bit more information is related to SEPs. So I want to turn to our friends at the Center on Budget, and it happens to correspond with the slide about some of their resources as well. But we got a lot of questions, I think this probably goes to Hallie, about what parts of the sort of SEP changes are already going forward versus which ones are we waiting for a finalized rule to really enact. And what's the timing for consumers when they provide documentation? How long do they have to wait till they can actually effectuate coverage to the plan, that sort of thing?
All right. So I'll take these. I'll start with these, and Shelby, you can jump in if I miss anything. But so for when things are going to change, all of the kind of changes, the pre-enrollment verification, those changes to what plans you can, whether for enrollees, whether you can that are limited and what plans you can change to, those are all in the proposed rule. So those have not taken effect. They're in the proposed rule. And we know that the timing for the proposed rule for the pre-enrollment verification is in June, and some of those changes to the SEP rules could happen quicker, but we don't know. So we'll be able to come back to you guys with more information on that once the rule is actually finalized. And then for the other part of the question, which I totally blanked on, can you repeat it?
Sure. It just has to do with we were getting several questions about what the process. So if consumer has to submit verification before they can be documentation before they're verified, how does the process move forward? What's the timing?
Yes. Okay. So the process as we kind of understand it right now is someone will go through the application, they'll get an eligibility determination, they'll be able to pick a plan, but that plan will be, their enrollment will be pended until they submit documentation to verify that SEP. So they'll go through the whole process, they'll pick a plan. Depending on when they pick a plan, it'll have sort of those normal coverage effective dates, but that date will be sort of put on hold, and that person will have 30 days to submit documents proving an SEP eligibility. And then once the marketplace verifies that, the enrollment will go through, and the coverage will actually start back to the original coverage effective date. So if someone loses coverage at the end of March and picks a plan at the end of March, and their enrollment date would be April 1st, and they submit documents, it's cleared, let's say the second week of April, their coverage will start April 1st. So they'll have to pay that first month's premium at that point.
And the only thing
there's some changes in that, but that's the big one.
The only thing I would add to that is that we've talked to CSIO a bunch of times about this, and they have, one concern we had was how long it would take for, documents to be verified, and still a concern to be, to keep an eye on at least. But they feel pretty confident that they have staffing and they have processes in place that they will be able to turn things around pretty quickly. So something to look out for.
That's really important.
Perfect. So I have, a couple more. I think we have time for about 2 more questions. And one, I'm going to stick here with my crew from the Center on Budget, but also there might be some others who want to chime in on this. Obviously, this is a time of great uncertainty, not only for health coverage, but also for immigrants and mixed status families writ large. But is it still safe? We've gotten questions. Is it still safe to advise mixed status families to apply for coverage? Will their information be safe with the marketplace?
So that's a great question, and I would say a couple of things. One, especially for mixed status families, one thing that they've often very concerned about is exposing the status of an individual in the family that maybe is, maybe they're undocumented, let's say. Not always the case in the mixed status families, but that happens. One great thing about the way that the FFM application is set up, and most Medicaid applications, the vast majority of them and the vast majority of state-based marketplaces, the way that it's set up is that you can identify individuals who are not applying for services for themselves, and those individuals who we talk about as non-applicants, they never have to disclose anything about their citizenship or immigration status. It's really important that you do that you identify them as non-applicants, and there's all sorts of reasons why people could be non-applicants. This might be one of them. The other one might be that because they have insurance from some other source. So, using that will help you to not overshare any information, and that gives a lot of reassurances to families. The other thing is that there are layers and layers of rules and laws that kind of protect how information is collected and then how information can be shared. So even if we were to hear of someone indicating that they're going to begin to use information in a way that you know, maybe they'll say, like, for example, there was a memo that came out that indicated that they're no longer going to apply the Privacy Act to certain groups. You know, the Privacy Act, that's terrible. We don't want. We like the Privacy Act, but that doesn't stop the fact that, you know, the marketplaces have certain rules and laws that they have to abide in terms of confidentiality of people's information. So I would say that we have not heard of any kind of information. We have no reason to believe that people are going to be endangering themselves by applying, but really taking advantage of the fact that you know, using the resource that, you know, people can apply with benefits without having to disclose any kind of information from non-applicants. That is important to do.
Great. That's such important stuff to be aware of. Thanks so much, Shelby. For our last question, I wanted to pass it actually to Liz Hagan at Families USA. We got a general question about the CAC program, the Certified Application Counselor Program. How is it faring through this changing climate, Liz?
Sure. So Mara talked a little bit about the Navigator program, and I just want to clarify because I think sometimes we talk about assisters generally, and certainly the general public doesn't distinguish between navigators, certified application counselors, in-person assisters. So just to clarify, Mara talked about the navigators and the federally funded program. Of course, state-based marketplaces have their version of that as well that they fund. But then I think the question is about certified application counselors, which generally do not have funding, or if you have funding, it's from typically private sources. And they were created through regulations, not part of the Affordable Care Act. But there's also what we consider certified application counselors that exist at community health centers around the country. And community health centers are funded through HRSA, which is a part of the Department of Health and Human Services. And the way that program is structured right now, the certified application counselors, they are part of the general funding that goes to community health centers. And I think we do have concerns about what that level of funding looks like because they provide such a valuable resource and coverage or services to people, a lot of people who are uninsured. And so I think there's an unknown there about what the funding for community health centers looks like in the related community certified application counselors that work there.
Great. Okay. Well, we don't have much more time, and we don't have time for more questions at this point, but I do really just want to thank everybody so much for coming out and listening to today's webinar. We had record attendance. Over 800 people joined us this afternoon, which is really fantastic, and I think just speaks to the pretty urgent need that all of the organizations on the webinar today, all of the panelists fill in their various roles supporting assisters. So on behalf of Enroll America staff, and I want to say really past and present, thank you for being such treasured partners. When we were a new organization, our staff often spent a lot of time explaining that despite our name, Enroll America, we didn't actually conduct enrollment. We described our role more as leading consumers to the front door of enrollment. But it was in-person assisters like you who opened that door and welcomed consumers inside. And for that, we will be forever grateful because you made the promise of the ACA a reality. People are alive today because of what you have done, and we have been proud to stand alongside you and support you through this journey. Please continue to do this critical work, even when times get tough as they are and have. Reach out to any of today's speakers with questions or ideas for how they and their organizations can be helpful to you. And again, thank you for all you do and for welcoming Enroll America into your world these past 6 years.
Thank you for your participation. This does conclude today's conference. You may now disconnect.